Hello, and welcome to VoxFem Global Health Minute. For those of you who are new to VoxFem, you can check us out more at voxfem.org. That's VoxFem.org. And our mission, and we chose to accept it, is we choose to find and feature exceptional women artists, singer-songwriters, composers, visual artists, filmmakers, and change makers from every nation and occupied territory on Earth. So, just a small little job that may take us forever, or we might do it very quickly because we have a sense of urgency about it. And we found some pretty remarkable women and continue to do so every day. So please check out voxfem.org. Part of featuring those change makers in health, this year we launched a Global Health Minute. So I am Dr. Annette D'Armata, your host, and this is VoxFem Global Health Minute. And since we never follow any rules, it's not a minute. It's actually going to be a lot of minutes, but we just thought we'd mess with you like that and just call it a minute and then get you in here, and then just once you got here, we just keep talking to you. So we begin each time by honoring the original caretakers of the land. And I want to acknowledge that, we're all learning in this process. And I want to acknowledge Tosh and Elena of Indigenous Ways. That was our first broadcast, actually, for our Global Health Minute. And in learning that we need to change the narratives. Part of healing is that we need to restore truth, and we need to acknowledge where we're standing. And so we broadcast from many places, but primarily from San Antonio, Texas. So we want to acknowledge the Estocna, the Carrizo Comecrudo, the Coahuiltec Nation. And we also want to acknowledge that this is the ancestral homeland of the Chicana, Chicanx, Chicano people. And we're very grateful to be here and to be part of that community. Let me introduce my guest today, our guest. First, I'll tell you officially who she is, and then I'll tell you a little bit more. It sounds ominous. So Dr. Tamara Dickson completed her bachelor's degree in psychology from SUNY Purchase in New York. Her medical degree is from naturopathic medicine is from Southwest College of Naturopathic Medicine and Health Sciences. And she completed a residency in naturopathic primary care and pediatrics in Seattle, Washington. She is the owner of Naturista, a multi-platform integrative medicine resource offering in-office visits in Seattle, where she's licensed to practice, as well as teleconsults and case review reports for people who are not her patients all over the world. She has taught and supervised naturopathic medical students at Bastyr University for several years. Additionally, she's an educational consultant for the GCRN, and we're going to talk about that a little bit, the naturopathic accrediting body in the United Kingdom. And she's an international continuing education lecturer for health professionals who need to get their continuing education credit. Her clinical focus is in the treatment of adult chronic disease management and mental health, and she strongly relies on the principles of nutritional biochemistry, botanical medicine, and lifestyle modification to help her patients achieve their goals. And so I said that's officially who she is, and I just want to say something else about her. Full disclosure, I have no objectivity when it comes to Dr. Tamara Dickson because I love her. I respect her highly. I've known her for many years. She's a classmate of mine at Southwest College, and my colleague now for 11 years in practice. And the rest of the full disclosure is that, and this will tell you how highly I think of Dr. Dickson and why I wanted to feature her so that you can also find her, learn from her, is because when I need to consult with someone about my own health, as much as I've learned and as much as I've dedicated myself to helping other people, when you're the patient, you need to go to somebody else. You need to, I always say, like, turn yourself in. So when I turn myself in, I choose to turn myself in to Dr. Dickson. So that is how highly I think of her. And so I hope that you will enjoy and get as much out of this today as well as I've gotten for all these years. So I want to share you, Dr. Dickson. Please welcome everybody. Applause in the virtual world. Applause.
Thank you. That's incredibly sweet. And even though I know that's true in terms of, helping you through, any obstacles that you come up against with your own health, it's still an honor when you remind me, when you phrase it in that way.
Yes. So, so I guess one of the things, so the title of this talk today has to do with integrative mental health and the healing power of storytelling. And, sometimes our global health focus doesn't coincide so tightly with or so obviously, I should say, with what artists do as well, right? So we have, what many of us in the arts who appreciate the arts understand as the healing power that art can have for someone. And very intrinsic to that, I think, is storytelling. It is someone being able to portray something that is sometimes very hard to put in like our normal daily conversational words, or maybe it's never spoken. And so that is something that you've been looking into a little more deeply. And I know you wanted to talk about that today. So tell us what you've been looking into in terms of the healing power of storytelling and how that relates to the naturopathic profession.
Yeah.
And research, some of the research you found.
Well, there's a lot to say. And first, I'll start small with my personal experience and then sort of broaden out to what the research says. Personal experience in terms of sitting across the desk from patients over, what's now been 11 years and still seeing patients when we were students training. So I think it's really more about 13 years at this point. I think anecdotally, naturopathic doctors understand that there is power in the way that we do a clinical intake with patients. And what I mean by that is how we get to know them and their health concerns. When you go to your physician, how much time do they spend with you? How many questions do they ask you? Are those insightful questions? Do you feel seen? And it's completely intrinsic to the nature of a naturopathic physician to see their patient. And I'm not really sure we fully understood that at the time that we were training. I mean, we were taught that we are treating the individual and that we're not treating a disease. So therefore, you need to get at the origin of what the disease is for that person with an understanding that it's going to be different from person 1 to person 2. You might be seeing 3 people that have chronic migraines, but the cause of their migraines might be different. And you're not going to be able to figure out what that is if you don't listen to them and if you don't get to know them. So I can't count really how many times I've had people in the process of an intake or after an intake just break down crying or just break down with gratitude at the mere fact that they were listened to and that I took the time to understand their story and see it as valid and give them, really just the basic respect that a human would deserve when they're coming to you for help. But it's a very powerful thing to have happen, across the desk. And like I said, that's something that we all kind of understand anecdotally. But then I started, for various reasons that we could get into, diving into trauma-informed care and what fosters resilience. I've always had an interest in mental health, and with this term or, sort of a movement about the awareness of trauma-informed care, I found myself, for my own research reasons, really investigating what it is that we can do for people to help foster resilience. Like, has it been looked at? Do we know what comprises resilience and how do you help feed that? It's a bit of a different question from how you treat a disease. You know, in treating a disease, you're trying to correct something that is malfunctioning or dysfunctioning. You're addressing pathology. Whereas trying to promote resilience, or what is really more of what's called a salutogenic approach, is that you're concentrating on what is going to strengthen and build a person. So it's really more wellness oriented instead of pathology oriented.
Yes.
So a couple of things came out of my diving into the research around what helps people become resilient, or what sorts of experiences help foster resilience.
Mhm.
And this is where I found the marriage, I would say, between naturopathic medicine or integrative health and the power of storytelling, is that there is research behind the fact that if you enable someone to tell their story, if you take the time to understand their story, they have better treatment outcomes. Now, again, between doctors, we might understand that and see it and live it every day. But when you actually see that there is objective research, you know, across numbers of people that show, if you take the time to talk to people and understand their source of stress, you know, any problems that they had in their past that might be contributing to their current situation, how they eat, how they sleep, the quality of their relationships. By listening to those stories and understanding who our patient is, not only do they often report better like physical outcomes, but they feel as if that is helping them become resilient. Like, we are now a resource for them where they feel safe and where they feel trusted. And a lot of what fosters resilience is knowing how to utilize your resources. And if we become valuable by valuing the patient and by valuing their story, it helps them understand themselves. It helps them understand, you know, their own wellness journey, and it's shown to have better treatment outcomes. So that's sort of a brief introduction to what has been, you know, a long sort of deep dive into the research around trauma-informed care and resilience. We've known, you know, with the sort of the passing of folk tales through time, that there is a healing power to storytelling, but I'm not really sure before we've ever come to realize that the listener, you know, in allowing that person to tell their story and allowing that person to feel seen as a result of having their story listened to, it is objectively, like scientifically, you know, shown to be healing.
That there's so much in there, and I'm going to be your questioner since we're not taking comments. I'm just so there's so much in there. One thing, I guess, you know, that many people may ask about, so I just want to like make sure that we go back there. So for those who don't know, you know, naturopathic medicine, at least in North America, and this is going to be relevant to what we're going to talk about, some of the work that you're doing internationally also. But as the evolution of naturopathic medicine, there's been a different evolution in the North America in terms of the state of the profession at the moment, which there are accredited medical schools. The toolbox includes conventional medicine. So there's a span from what people think of as natural all the way through to conventional. So the toolbox is bigger. It includes all of that, right? And the idea, this is a very, you know, brief, the briefest introduction, but, you know, the least toxic intervention that is appropriate at that moment. So don't blast an anthill with a nuclear weapon, and, you know, don't put chamomile tea on a compound fracture, you know. So there's like, you have to do what's appropriate at the moment. And so that's the training in North America in those particular schools. And there's a wide variety of, each state has its own legal status, you know, scope of practice. So it varies. And so that's one thing. And the other thing about it is that the training, when you're talking about having this, like listening to the story. People may think, well, what doctor listens to a story? Well, part of the idea, the training is, at least how we're trained. Now people may modify it a little bit, is we really take about a 90-minute or an hour and a half first intake. So your first appointment is an hour and a half. And while this information applies like beyond naturopathic medicine in terms of like healing, I think it's important because, as you and I have talked about a lot, people often say after that first appointment, I feel better. No one has ever listened to my whole story. I've never been able to talk about my whole body and my whole mind and what happened to me, the trauma that you're talking about, like the trauma-informed care. No one's ever given me the space to do that. So that in and of itself, and then you've gone beyond to find research that, although it uses different language, like salutogenic, like salute, like drinks, you know, like to your health, salute to your health, salutogenic, you know, you found research that uses different language, but is essentially the same. It applies to what's being done. And so that's a big, you know, that's an important contribution.
I think so. I mean, I would argue that it is one of the most important contributions. There are several ways in which naturopathic physicians are trained to think differently from our, you know, traditional medicine or allopathic medicine counterparts. So it's simplistic to bring naturopathic medicine down to that. But I think what people miss and what makes people the most upset and probably leads to the most sort of medical injury and neglect and malpractice is when physicians do not listen to their patients. They don't see them, they don't remember them. You know, there are plenty of times, you know, that people have ended up in my office and end up in naturopathic physicians' offices because they have felt, you know, let down by the traditional medical system that is in place. And a lot of that, I think, does have to do with the fact that we have the time, we take the time, we want to listen and understand all of the variables about the individual in front of us in order to come up with the best plan for them. We know what the medical algorithms are, but we still find a way to individualize, you know, our treatment plan to the patient. Because to go back to the migraine analogy, you know, we investigate and treat the cause. That is our purpose. You know, we're all investigators, we're all researchers within the patient's own history so that we can find what the cause is for them and build a treatment plan for them. And I think that is very different to you know, the prevailing medical system that tends to treat the disease and tends to treat people the same way as a result of their diagnosis. Having a backstory and an understanding about the person that is sitting in front of them is often gets lost. And I mean, I don't know how we ended up there. You know, we ended up in a place where in our larger medical system where we have forgotten that there's a person sitting in front of us, and instead just see the problem that needs to be solved. You know, we see the rheumatoid arthritis, or we see the fibroids, or we see the hypertension, and just, you know, focus on that pathology. And we've just, you know, we've completely lost the person. And I think that's how people end up in our offices. I think that's why people stay in our offices, is because we value the story, we value the individuality, and we need to see the person, the whole person, in order to treat them adequately.
So we are, you know, today it's Monday, November 2nd. No tension or anything on Earth right now. Just everything is lovely and peaceful. And so given that just the normal state of things, and then given today being the day before the US elections, which has caused, you know, quite a bit of heightened tension. It is also, as most people know, because if it doesn't affect you, it affects somebody in your life. And obviously if you're a healthcare professional, it affects your practice. It has exacerbated mental health issues. Anybody who, has been suffering, there are many exacerbations. It's just worse right now, right? It has also exacerbated physical issues. And I want to say something about that since we're talking about integrative mental health. One of the things that you and I always talk about, so I want to share this, is that interestingly enough, many people think, the mythology around what a naturopathic doctor may do for you or think when you go into their office. When people come in with what anxiety, depression, could be, something, another diagnosis, but let's say they come into your office for one of those common complaints. And it's only been naturopathic doctors, in my experience, who will, maybe because of the time we take, rule out that it's not based in a physical issue, that, that your anxiety is not actually, hyperthyroidism, that you're not having an elevated, heart rate and it feels like anxiety, but actually there's a physical cause for it. Or, the same with depression, the same with, any number of conditions. We go through the full rule out on physical issues to make sure. So that's also part of the integrative approach as well. So what have you, I guess, in this particular time, not only the elections, but also, what do you want to call it? The reanimation, the through the roof brutality that we're having to witness, that the people are being re-traumatized. And and I always say, when somebody comes into your office with anxiety, you need to know, is it pathological? What is pathological to a person? What is pathology? Maybe that's actually, if somebody comes to you and says, every time I leave my house, I'm afraid I'm not going to come home alive. Are you delusional, or are you Black in the United States? Are you a Black person in the United States? I mean, you better know the reality, and if you don't know it, then that's what your time with that person is for. You don't have to pre-know everything, but you need to listen and understand and sort out what is when we say pathological, what is something that is causing harm to that person, what is, damaging to that person's life, or and is it something that we need to treat, or is that kind of a rational reaction to what's going on, and do you need to help that person problem solve and maybe refer them, deal with social determinants of health? We do a lot of casework essentially and get them to the therapies and resources, and some things require a political solution, but we do what we can. So what are you seeing in terms of that right now? Like, what is your current insight right now?
Yeah, it is. I mean, it's a big topic, obviously, but I would say that the results are results are kind of all over the map. And I think, there's a continuum, and I can identify maybe like 3 distinct groups. And this is amongst the patients that I'm seeing, and it's also with friends and family. Small group of people, I wouldn't say that it's, I wouldn't say these are evenly distributed, but I've definitely noticed a group of people that feel that they have been able to simplify their lives as a result of, a lot of the COVID lockdowns, for example, and working from home, and their lives feel more manageable now than they did previously, because the lockdown forced them to give up some extra shit that they were doing that was running them ragged, for example. I've definitely heard lots of people say, I feel so much better now that I'm not running all over town, running errands and doing this for the kids and doing this for work. Like, some people have really found wellness and grounding and clarity because for them, this period of time has been comparatively more quiet than what their lives looked like before.
Yeah.
it's not, like I said, it's not an even distribution of people, but I've definitely been, well, happy for the people that report that this has actually helped them sort of rest and recover. It's given them permission to rest and recover. That's some folks. So for example, I will give you an example clinically, because I'm just so used to talking about case studies.
Mm-hmm.
In this period of time, I have a patient that has come off antidepressants. So considering all of the stresses that we're talking about, sociopolitical, infectious disease, financial, because of the variables in this person's life aligning in a particular way, and lots of work that they did ahead of time up until now, they have successfully weaned off of antidepressants and are doing fabulously. So that's an example of a success story of someone that's been able to use this time for introspection and for, like, you know, sort of propelling themselves to the next level. Then, of course, there are the folks that are anxious, can't sleep, depressed, you know, have lost their jobs, are worried about their finances. I mean, lots of people, quite obviously, have had their entire lives thrown into a tizzy and are on a roller coaster every day. I mean, a lot of times people don't know how they're going to feel, and they're just like working with whatever skills they have at the time. You know, some people are tanking. And as you mentioned, there are sort of pre-existing situations that have been exacerbated by the socio-political climate and COVID, infectious disease, et cetera. We know that, you know, cases of domestic violence, for example, have rose, and I'm certainly having people more like speak to me medically more about depression and anxiety. And that, of course, begs the question right now of like, well, do you have reason? Do you have understandable, rational reason to feel this anxiety? Yeah. And that is put, I think, physicians in a really interesting corner, because you don't want to pathologize normal, healthy responses to stimulus. I mean, if we're going to make it, you know, sound sort of removed and scientific, that's exactly what it is. Here's a stimulus, this is a healthy reaction to it. And in this case, it happens to be anxiety. I'm seeing that more than depression at the moment, I would say, at the uncertainty that lies before them, uncertain about their job, uncertain about their personal safety, both due to police brutality and infectious disease, the uncertainty of, you know, conditions that they need to have managed, but have needed to put on the back burner because they don't want to be anywhere near a testing facility or a hospital. So I've had conversations with people about how to balance like two shitty situations. You know, you have these long-time symptoms that really should be evaluated right now, but are you more at risk by going to your local testing center to get more information? Or are you more at risk to not have that evaluation right now? So there's been a lot of like patient like negotiating in terms of, well, what is worse for you, for this situation, for this pathology? Like, how do we make the best of this, of these two hard, you know, decisions that we have to make?
Right.
And then there are people that are just hanging out somewhere in the middle. I mean, I think there's a few people that are actually doing better. Most people are in various phases of panic, and there are people that are in levels of panic where it is interrupting their health, their functioning, their sleep, their relationships. And then there are the people in the middle that have more skills, more resources, more support, where they can kind of go in and out of feeling like they got it. You know, they're just like, okay, I get this quarantine thing now. Like, I know, like, I finally got my kids in their homeschooling schedule set exactly right. And I finally understand how I need to work from home. And that can last for a couple of weeks before you get rattled, you know, by something. So I'm not really sure whether that answers your question, but I've seen people fall into to different categories I mean, basically since February. It's been interesting to speak with people and do patient intakes, you know, over this period of time because, well, when you speak to a naturopathic physician about anxiety, going back to what you were saying before, you build a list of a differential diagnosis. When people say that they're anxious, we talk to them about, well, what does that mean for you? And what does it feel like in your body? Are there any symptoms associated with it? And according to everything that they say, we start building a list of things that could be causing that anxiety. It could be a neurotransmitter imbalance. It could be a food allergy. It could be hyperthyroidism. It could be that they're drinking too much coffee. It could be that they're in a shitty relationship. Never before, I mean, has, you know, global pandemic been on that differential diagnosis list. I mean, it's not something that we've had to consider before. And it's been an interesting situation as a physician to try to massage people through it, right? Because you don't want to just numb out a healthy response, but people do still need to live their lives. So luckily we have a lot of tools in our tool belt to try to help people stay level and to feel like their lives are manageable.
Right. Well, for all of those people, wherever, if for anybody watching, wherever you find yourself on that spectrum that you just described, I think you described us all. Well, you covered us all in there somewhere. I mean, you're a great resource. I know we're talking about in some ways naturopathic physicians and that intake. We kind of also that long intake, that allowing somebody to tell their story, which can be done in a number of different ways, and this is sort of one of them, and the research that you found for that. But you yourself are a resource, and one of the things we've also talked about is that you know, to be a healthcare provider, you don't have to have the same experience as your patient to be effective. You can do that. You know, however, and you know, and many people who will watch this, and some know and some don't. You know, I live with autoimmune disease, so when I choose to share that with my patients who have autoimmune disease, and I find that it's very comforting to them to know that I bring to that not only this kind of body of knowledge, but also my experience as someone who's been misdiagnosed, who has not been believed, who has, you know, that suffering that people go through is, it's at least as harmful as the disease itself. The kind of mental, emotional impact of chronic disease and living with that is profound. So while I come from a time where you don't disclose, you know, like you don't disclose a lot about yourself. I do choose to do that. I have admired very much. I know you have an Instagram account, and you have, you know, we're going to put the links below for your for Naturista, but you're not only a resource for your patients, like your actual patients in Seattle, right? But you also have chosen, as you've kind of gone further and further into this journey of being a resource for people in terms of integrative mental health, you did a series of videos talking about your own story. And I think it was very, very powerful. And not to put you on the spot, I mean, you can, but I would love for you, whatever you feel comfortable talking about, but you had those Instagram, very short stories, giving people insight into your own very powerful, very difficult story. And yet it is a story of resilience. And so it can be something that is powerfully inspiring to people, and also to feel they're not alone, right? That's one thing. And then you also told me some stories, a very powerful story about memories that you have of when you decided you wanted to, what provoked you to want to be a doctor. And they were some very powerful stories about trauma in the you know, socio-political world around you, even as a child. So without, you know, whatever you're comfortable with, I think those stories are very powerful, if you'd like to share any of that with the
Yeah. Well, I need to organize my thoughts here a little bit. I'll start at the beginning, which is, when I realized I wanted to be a doctor. And that was a trauma-based story. Now, I'd love to throw in the asterisk here that is not the word that I ever would have used at the time. The word trauma has really entered our sort of like social lexicon and is being used more often, I think, than it ever has been. And that's not to say that traumatic experiences weren't happening before. Of course they were. All of these things were happening before. It's just that now we're naming them and we're calling them out as being a part of these types of experiences. Whereas before we would just say, like I had a rough childhood, or, that relationship was kind of hard. But now we're able to say like, oh, actually I'm suffering from complex trauma. And so it's good that we have names for it. So when I was a kid, and I think it was around when I was 8 or 9, I think I realized at the time I was watching a news story. So I grew up in and around New York City. We were watching the news, and the court case having to do with a young girl named Lisa Steinberg came on.
Yes.
And I think you had mentioned to me that you were familiar with that case. It was hard to be a New Yorker in 1986 or 7, whenever that happened, without you being aware of this horrendous child abuse case. And what struck me is that, Lisa was a child. She was killed by her father after a long history of physical, emotional abuse, neglect. It was a horrendous story.
Yeah.
And at the time, I remember being really upset. I was really not upset at the fact that something bad had happened to this child. Of course I was upset about that, but I was upset that no one was there to protect her.
Mm-hmm.
And this case has since gone down in history as one of the cases that influenced some changes in the law in New York City around how things get reported to Child Protective Services and the types of follow-up, et cetera. Her death, unfortunately, caused the authorities to self-reflect in a positive way. But at the time, I saw this little girl on the news, and I was just like, someone should have been there for her. And my little 8-year-old mind thought that it would have been a doctor. And I said, well, if I can be a doctor to little kids, then I can protect them and I can help them when bad things are happening. And I wanted to be a pediatrician for a really long time, until I started studying psychology, and I just realized I was interested in healing everybody, not necessarily just paying attention to just only serving the pediatric population. There were two key experiences that happened around college age, that one personal and one a little bit more academic, that also propelled me more towards becoming, a naturopathic physician. And again, I didn't have words for it at the time. In terms of mental health, I studied psychology. I've always been interested and fascinated in human behavior and, in this crazy experience that we call life. I'm curious. And it ended up that I got assigned to investigate and do a report on schizophrenia, which is also, a very debilitating and poorly understood disease. What I found at that tender age of, whatever I was, 19, was that in investigating the research, that there were prenatal and perinatal determinants, things that could have happened in the womb and things that could have happened during early infancy, that were strongly correlated with the later likelihood that that person was diagnosed with schizophrenia. So like maternal viral illness, for example, is one of the things that has been correlated to a later diagnosis of schizophrenia. At this time, I was completely gearing up to be a psychiatrist. So I was still on the doctor track, but like with the psychology piece sort of folded in there. And it was in doing that research that I first understood the importance of the person's story. and the importance of the person's history. And once I could see objectively in the research that there are things that could have happened in your history that lead to this later diagnosis, I suddenly realized that I was never going to be satisfied just palliating symptoms as a psychiatrist. I realized in studying schizophrenia that when you take the medication away, the disease is still there. You haven't actually cured anything. And that stopped me dead in my tracks at an early age in becoming a traditional doctor and following through with the common trajectory of being a psychiatrist, because it wasn't enough. I felt like we were missing something. And then secondary to that and more personal is that I had been treating myself with herbs and homeopathy and acupuncture for my debilitating, what were later diagnosed as food allergies, because no traditional medical doctor had ever diagnosed me appropriately. No medication ever worked. I couldn't deal with the side effects. I was, the patient that I see now, misdiagnosed, misunderstood, and had a list of symptoms that were only ever being palliated at best, and we never got at the cause. So being sort of life groomed me into being, a naturopathic physician that focuses on mental health through all of these different experiences. And one was just trying to protect people from the injustice of the world, and like having some insulation to give people support when things are hard. And in that case of Lisa Steinberg, it was parental abuse. But stress, as we now understand, is registered by all sorts of things. Your body will interpret autoimmune disease as stress. It will interpret insomnia as stress, or over-exercising, or watching, police brutality on a TV screen, knowing that you can't be safe walking down your street for fear of being taken out by, some some self-important police officer that has to prove something. Your job can be stressful, etc. So how do I help insulate people from those sorts of experiences? And that sort of, all of that led me to both naturopathic medicine and focusing on mental health as a result of that. And then personally, I am a complex, trauma survivor. I was raised by alcoholics and drug addicts. And, while my parents did the best that they could, I didn't understand the full scope of the healing that I had to do until I was in naturopathic medical school, and we were encouraged to look at ourselves and make sure that we didn't have any barriers personally to treating people, with the unconditional positive regard that they need to be treated with. And I also learned a lot through education. I think education was also really transformative in taking me out of what was essentially, like a poor and abusive, sort of ghetto childhood, and into a realm of appreciating education and expanding my mind and understanding that that there are tools. That's what education really does, is that it provides you with tools. And I understood personally, and I started to understand, in terms of being a physician, that, the power of being able to tell your story, and the power of just being, like I said, just sort of being seen without any judgment. And I think whatever, from a mental health sphere, whatever burdens people are carrying, it could be the burden of your chronic pain due to a physical illness, or it could be the burden of, caretaking, someone at home. Could be healing from complex trauma. What I got to understand through my own therapy and treating patients is that this is part of the human experience. These are the things that happen to human beings while we're alive, interacting with one another on this planet. and that we need not be ashamed of anything. We need not be ashamed to anything because we're not alone. And I first was really, it was easy for me to apply that to patients because I could see them not wanting to tell the full truth or something, or be embarrassed about something. And I'm just like, oh, this is super common. Like, there's no reason to be embarrassed about it. Bodies do what bodies do. No judgment. But then it took a while for me to be able to apply that to myself and dismantle a lot of the shame and dismantle a lot of the guilt and like the maladaptive behavior patterns that I, like the protection patterns, emotional protection patterns that I had established from having such a hard childhood. And finally realizing that telling the story is liberating, and that being heard is liberating, and being seen is liberating, and that at the very least, you know, it usually takes pressure off of your chest. But, you know, to go back to the theme of storytelling, it can be inspiring to others. You know, you being honest about the situation that you're in or a situation that you've been through may be exactly what a fellow survivor needs to know that they're not alone, and that you can understand them with compassion, and that maybe they need not carry so much shame about their experiences. I think it's a very long-winded answer, but that's, you know, how I can sort of connect you know, my personal experiences and my identities into this connection of integrative mental health. I've seen a lot, you know, both like academically and medically as a physician, but I've also been through a lot as a person, and I have been very lucky to have just the most amazing community support, nourishing friendships, access to education and to therapists and to tools that enabled me to entangle the knots of trauma that I had experienced. So
it's a beautiful answer, and because it's the truth, and that's really the, you know, when you said so many things you said, but when you said that just untangling for someone, that, you know, there's no shame, that you know, you're not alone, that there is no shame in whether it's your history. People have shame about their history, particularly when there's abuse involved. There's a lot of shame, and that's one very particular case where it's of utmost, it's urgently important that you're able to tell that story, and not just to tell it, because there's a lot of disclosure these days. But the other thing you said that's very important is that unconditional positive regard, to be heard and valid, and to be heard, not just heard where somebody has some other scroll going on in their head, you know, you can feel that. But when somebody literally is listening to you and internally there's a coherence where you're literally listening with unconditional positive regard for that person's story, that's healing. That is healing. And if you're listening and you know, you're nodding, but inside you're having judgment, that's not healing. That's not healing. That's not healing for your friend. And just in case, like, because this, like I said, it goes beyond just the intake. If we listen to each other, but I see sometimes that, you know, even people who love each other, friends, couples, parent, child, like, just listening and just let them say what their truth is without that judgment is so powerful. It can break through so much. Like, you actually don't even know where you can get to until that happens. You have to break through that.
yeah.
And so you know, that's a very important point that you bring up. And it made me also think about social media, and how some of us who are older, I worry a lot about the younger people who've grown up with almost all of their input, at least their daily input, coming from social media. So say somebody puts something that's very disclosing, they're trying to, like, they're trying to get there of telling their story, and they put something in their social media, and then there's this combination of responses from, like, you know, ranging from, you know, truly like unconditional positive regard. There's always, you know, and then there's the kind of the fake, you know, you can tell they're not really, there's some judgment there, but it's clouded. And then there's outright hostility. And it just pains me when I see that, because I think it's such a vulnerable place for people to be in.
Mhm.
And then they're just getting these spears back, and they're not, you know, that's, that's not, that's not how to build resilience. That, you know, you were talking a lot about how, you know, like, so we need other tools, and not just naturopathic medicine. So if we can say one thing, I think important to, you know, use the tools that you have access to, and be a tool for somebody else. Be a tool. Be a good tool for someone else, right? Because that's what we need moving forward. Um,
Can
yeah, yeah, yeah.
I want to piggyback on that because
You got me going.
well, those two things, among lots of other things, are some of the attitudes and behaviors that are known to help people become resilient and to foster resilience. And one of them is meaningfulness and having some sort of like sense of belonging or community ties, you know, and it's a very broad, there's a lot to say there, but in terms of feeling like you're a part of something larger, whether, and I mean, that could be anything. That could be your family unit, it could be your church group, it could be your salsa dance team, it could be, you know, your mommy and me group that meets every Tuesday. But knowing that you're a part of something that is meaningful to you is part of what helps people be resilient. And the ability to use your resources is also one of them. Now, you need to have access to some resources, but there's kind of two parts there. There's one is like knowing what your resources are and then having the internal motivation to utilize them at the time. So, you know, that would be, you know, I'm overwhelmed with this particular part of my schedule, so I'm going to see if I can call my sister for childcare. That is a healthy reaction. That is knowing your situation, being able to like understanding your situation, knowing your resources, and then using it. That those behaviors are known to be the behaviors of a resilient person. And what's cool about that is that it can be taught. And I think that's maybe just one other thing that I'd like to mention about like all of the research that I've done into the nature of resiliency and trauma-informed care, because it ties very much into just mental health in general, and also you know, not being ashamed of your situation or of your history, is that resilience isn't something that you are born with. Resilience is something that can be taught to anyone at any time. It's accessible to everyone. Resilience also changes. You can have all of like lots of variables in your life in, let's say, your 30s that lead to you having very strong and resilient reactions and characteristics. But if all of those variables change, your job, your family unit, your relationship, your financial situation, if all those things can change, so that resiliency can also be lost. It's a very dynamic type of a characteristic or of a principle. So especially for people that are struggling, for people that have had, you know, difficult histories or are suffering with difficult illnesses, you know, if you're feeling like you can't do it, the truth is that you can. You just need to be shown how. You know, resilience is something that everyone has access to with the right education. And I know we said we weren't going to bring it back to naturopathic medicine, but I have to, you know, another way in which we empower our patients, and, you know, empowerment is a huge principle within the trauma-informed care principles within the movement, is that we do teach people what their resources are.
Mm-hmm.
You know, we provide referrals when necessary to whomever, to the endocrinologist, to an acupuncturist, to a lactation consultant, like whatever support people need. We're trained to try to find that support for a person. But then there's also
where they sell goat milk in their region.
Yeah. Well, I mean, I've definitely never given that referral, but I have found myself looking up all kinds of resources for people to help them with their situation. And then we also tend to teach people more about their internal mechanisms. We have, by way of being human, we have inside us incredible ability to tap into body processes, even simple things like deep breathing or mindfulness that will help us, be stronger in the face of stress and to become more resilient. So again, another long-winded way of saying that, it's out there for everybody. It's not a like you have or you don't kind of a situation. You can have it, you can lose it, you can get it back. So if you're not feeling particularly resilient at the time, that's okay, because you can learn how.
So when you're talking about all these different tools, like you're mentioning breathing and mindfulness, and and then there's medication and there's botanical medicine, and there's all these things that for some people that may seem like uh, a grab bag. It's like for them that those things don't come together, and that's why I know that you and I were attracted to this profession, because it is the synthesis of all of these forms or modalities, right? Modalities of medicine. Almost some of them are their own systems in and of themselves, but there is a way that you can bring them together. We often say it's not that we don't have enough tools, it's that we have too many.
Sometimes.
And so the key really is what's needed for that person at that time. That's why I'm joking about the goat milk, because sometimes it's about somebody needs to find goat milk in their region, and that's the casework part. That's like our other modality is the casework that we're that we do, because we know that may be the obstacle to cure. So that's part of our mission, is to remove obstacles to cure. And so when you're talking about combining, let's say, prescription medication, botanical medicine, acupuncture, mindfulness, all of these different treatment options, these possibilities, like this realm of possibilities, that is something that we bringing it back to kind of the I know we want to talk about some of the work you're doing internationally. So all of these things that we're talking about, combining and being able to have all these tools to offer a patient, right, to offer someone, is the purview of a naturopathic physician who's trained in North America. And with the caveat that certain states allow us to practice the full scope, and others we're still working on it. We're still, like some of the other professions, it takes a while to gain all 50 states. We're at a little over half, I think, at this point. So, but being able to be trained fully to do that and to be able to offer that is amazing for medicine in general. It's such an amazing thing that when you come to sit down and you're feeling hopeless, you're feeling like at the end of the road, because they've told you there's nothing that can be done for you. This drug is not working, that drug is not working. And then you find out this head explosion, there's a whole world of things that you may need that prescription medication, but you may also need a dietary change, a lifestyle change. You may need this breathing exercise. You might need some botanical medicine that is not going to cause an interaction, which we're the only people trained in that. I'm just going to throw that out there. But in other countries, and this is where you come in, in other countries around the world, naturopathic medicine has not yet had that evolution. So what we have is piecemeal. We have what people call naturopathy, naturopathia, naturopractic. There's all these different words in different countries, and they mean absolutely, completely different things. So it can cause a lot of confusion, right? And while everybody has the best of intentions and may have a little piece of the elephant and may do great work, it's not the same. I always think it's important just for people to know what they're getting. So part of there's this body, the GNRC. And I want you to tell us more about that. Just how there's the beginnings of some conversations around everybody around the world who is involved in some level of the history of naturopathic medicine and where that's going, and what do you have to do with it? What are you doing?
What do I have to do with it?
Yeah, what do you have to do with it?
Well, it's the GCRN is the naturopathic authority and accrediting body in the UK. So it's exactly like, you know, maybe the AANP in the United States, or maybe even we have another board. It's like the Naturopathic Education Board. And the GCRN in the UK will evaluate a person's education and their clinical experience to determine whether or not they, you know, meet the requirements of the title naturopathic practitioner. And that is different to how we are trained in North America. Our North American training licenses us, it prepares us to be doctors. I mean, the first 2 years of our education, you know, as you know, is almost exactly comparable to medical doctors. And we still learn all of the pharmacology and minor surgery and emergency medicine techniques, alongside lots of lifestyle modification like nutrition, botanicals, and hydrotherapy, homeopathy, etc. So we actually do have a unique hybridized education that allows us to be both naturopaths and doctors. So we're naturopathic doctors. In the UK and also most regions of Europe, you know, including Spain, for example, definitely France, and I believe Germany, a naturopath is someone that doesn't, you know, they have all of the training in various natural modalities, but they are missing, you know, a large portion of the medical training. So they are more, how do I say? I mean, we are actually integrative doctors, you know. Naturopathic physicians in North America are trained to be truly integrative. We have a hybridized education, whereas naturopaths in other places have usually a collection of eclectic coursework having to do with alternative therapies, and usually alternative therapies only. And it's not to say, I mean, of course, those people are still very wildly helpful to the populations of people that they serve, because they're presenting options to people that, you know, educated options, informed options to people that previously didn't know, or you know, how to use botanical medicine or how to use nutrient therapies to their benefit. Right. So I came to work with the GCRN as a result of them seeking to basically build a continuing education program that they owned for themselves, to make sure that all of their naturopaths were at even levels of competency and education. We are really lucky in North America in the sense that we have, I think now 6 or 7, you know, accredited schools where the education is more or less standardized. We take the same sets of standardized tests, regardless of the school that we went to, in order to earn our degrees. Mm-hmm. And that has fallen apart, at least in the UK specifically, where various naturopathic programs have sprung up and then dissolved. Mm-hmm. And there was never any uniformity amongst what the curriculum would be. So there are some naturopaths out there that don't know a lot about nutrition, and there are some naturopaths out there that don't know a lot about homeopathy, and some that are really weak in biochemistry, and other ones that don't know anything about hydrotherapy. Like, there is no standardized curriculum. Mm-hmm. So I've been working with the GCRN to first understand, and we've actually gotten really far, first understand what the practicing naturopaths out there know right now. Like, what do you know? What don't you know? And now we're in the process of building those bridges so that we can bring the people that don't know some stuff up to a standard. This is a tiny subset, though, of what's going on in the larger global sphere, because it is nestled within the World Naturopathic Federation's mission to come up with understood definitions and qualifications for all of the people in the world that call themselves naturopathic. Mm-hmm. And they've also made a lot of progress in the past couple of years with their research, mm-hmm. and have been able to identify essentially like tiers of study hours. And It speaks a language that we don't really talk about in the United States very much, but the North American naturopathic education has, you know, whatever, it's like 4,000 or more, you know, studied clinical hours, and that's sort of the highest tier. And then there are other tiers where you've done like somewhere in between 2,500 and 3,000 hours, or if you've only done 2,000 hours. And so they're starting to plug countries into these categories with an understanding that, like, okay, most European naturopaths are a level 3 accreditation, and the Australian naturopaths are a 4, and the North American naturopaths are a 6. And there is a long and very passionate effort, you know, for Europe to come to a standard and a consensus in and of themselves as to what a naturopath means and what the services that they offer would be. And then, like I said, that's sort of nestled within this larger scale research that the World Naturopathic Federation is doing to also come to a mapped understanding of the qualifications of naturopaths in various parts of the world. So I've been helping, you know, the UK just try to come to a more uniform and higher standard for the practitioners that are already practicing, with the hope that we can build bridges for people that have some qualifications, but not enough to be recognized as a naturopathic practitioner. People that have gone to like lesser degree programs and they know some stuff, but they need to know just a little bit more in order to be acknowledged as a naturopathic practitioner. So we're kind of doing those two things at the same time.
So that, I mean, one of the reasons you're here is because you're a change maker in health, and so this is something that is making a big change. And I know that you know, anything to do with education and multiple countries is going to be small steps, right? It may seem like small steps, but then those steps really have like giant echoes sometimes. And the other thing about it is that we're in an, everybody says it, but we're in an unprecedented time. And so, you know, time space fabric is stretchy, and things that we do just are, things don't move in a normal way. So I kind of have hope that much of the work that you're doing in that realm is actually going to have some transformations that are faster than we may expect. And because I think the world needs it. I think the world needs these things that we're talking about. I think these are tools that are there. And and you know, when we talk about like healthcare reform, we're often talking about, you know, accessibility to, you know, to basically to emergent care, like to, you know, you need to, but we're not really talking about how we're going to change. Is everybody having access to 6 minutes and a prescription pad is not exactly what's needed. So we really have to bringing this to the forefront, and the work that you're doing. That's why I want to highlight it, because this is all behind the scenes. I mean, you're doing a lot of this work, building quietly, just like you know, work quietly to transform your patients' lives. Like when somebody's sitting there in front of you, and I said a little of this in the beginning, but I'll just say that, you know, I mean, you just have one of the brightest minds that I know. And so when I put my life in your hands, when I, you know, I know that when I'm scared and when I can't think straight about myself, that I have complete confidence that, you know, you have a cool-headedness and an access to just a computer in your mind that can just span all these things that we're talking about. That's you know, who you are, and that's what you have access to. And so you bring that to your patients, you bring that to the profession, you're bringing it to the world. And we haven't even touched on the fact that, you know, as exhausting as it is, you have also, you know, risen up to the occasion to address racism in our own profession. So we've been talking about, you know, the wonders of naturopathic medicine, but we're also critical of it, you know, and that's important to be so. And so in this time, you know, racism has reared its ugly head, and while it's exhausting, And you know, you have been a voice, and you have stood up and been an important voice behind the scenes, and also, and I've seen how you have, you know, your voice has made a difference already in some of the actions that the schools are taking and so forth. So um, we feature women who change molecules. That's what we say. We rearrange our molecules. So you're a molecule rearranger, and so is there anything else that we haven't touched on that you want to talk about? Now, I also want to give information. You're taking new patients, right? You are currently taking patients?
Yeah, in Washington, if you live in the state of Washington, we can be part of a doctor-patient relationship. But for anybody outside of that state, I'm simply, providing, educational reports and consultations.
Yes. So we'll give that. I'll when we get off, I'll put the links in the. But you could say it. You could say where people. What's the basic place where people can find you?
Yeah, my website is naturistalife.com, and there's a contact form there that you could, send me some information if you're interested in being seen or interested in consult report. I've tried really hard to make sure that my website is clear and informative, so you should be able to find what you're looking for and what my services are there. And then pretty much ever since the pandemic, threw us all into lockdown, I've been really rigorous about my Instagram page as well, because people are needing, remote access to care. And if we're spending more times on the internet and less time with people in person, I thought I would join the many voices that are trying to put some positive and supportive information out onto the interwebs. So my Instagram is The Naturista Life, and then I'm also on Facebook as Naturista Life as well.
Okay, great. And yeah, please follow her. She's got other things going on that are just still in the oven, and we'll have to talk about them later when they happen. We'll
Yeah,
have a
when they
follow up. Is there anything else that you wanted to say that we didn't touch on? Because you know I get excited and I start riffing off what you're saying.
Yeah,
So I might have
there's
forgotten.
lots to say.
Yeah.
And recently I wrote, well, there's two things. So I spoke recently at our Psych AMP, the Psychiatric Association
Yes.
of Naturopathic Physicians, had their first conference of their own this year, and it was really well executed. And I loved being a part of it. I loved all of the presentations. And the research that I did there, as I mentioned, was around this intersection, this really cool intersection between naturopathic medicine, trauma-informed care, and salutogenic psychology, like a positive psychology approach that I was talking about earlier, which is really more health promoting instead of addressing, disease or pathology. And it was really cool to see in doing that research, like I said, how much is accessible to everyone, and that resilience can be taught, because times are hard. I mean, this is what we're talking about right now. This year has been hard as hell. And for anybody that has been through some stuff previous to this year and is trying to heal from shit that was going on in their past, let alone the things that are going on in the present, it's been rough. And so I found myself, as I always try to package things in ways that are manageable for people, because if you're already stressed and overwhelmed or anxious or depressed, you need information presented to you in like manageable chunks. So I seek to do that. And I recently wrote an article for the GCRN. They're soon going to have their magazine published. It's called Natura. And I wrote the feature article on mental health. Piggybacking on the presentation that I just did, I realized something very important that everybody needs to hear, especially peeps on the struggle. There are so many things about human beings and about our communities that are strengthening and healing, that when we talk about resources, I feel like there's always this, like, the subtitle is like, we mean money. and sometimes we do, but there are resources within our bodies and within our spirits that that perhaps you haven't learned are there, but they are there. So the upcoming article that I've written breaks down mental health resources into categories. And that is, what sorts of things do you have inherently inside you as a human being? What sorts of things could be immediately within your reach? And by that, I mean without spending money. And then there's the third tier, which is, what sorts of things can you invest in? What can you spend your money on to help you? And, you know, 2 out of the 3 tiers, if you organize information that way, 2 out of the 3 tiers are about your capacity as a human being and the very simple things that we have available, you know, to us by way of community and by way of nature, by way of music, things that we can access for free that keep us healthy, proven, scientifically proven to keep us healthy. So I feel, you know, having come from a family on the struggle myself, that I need to speak to people like me and say, there is plenty you can do. There is plenty that is within reach for free without having to spend any money. You know, you can still heal, and that wellness can be yours, you know, despite what, you know, resources you think are available to you. You probably have more than you think.
I love that. Thank you so much. And so if you want to get some of those faux free resources, you can go to Dr. Dickson's Instagram account, where I know that you post lots of information like this, like just bite-sized information for people regularly. And so that's one place where you can go. And another place where you can go is voxfem.org. Bringing it back to really the mission of what we're doing, is that often women and women of color and LGBTQ are often the voices are not seen and heard, the representation's not there. So you think that your story is, you may be alone. And these women artists are just remarkable, and change makers are remarkable. They may not be known, or they may be well known in their profession or in their genre, but not, or in their region, but not known more widely. And part of that has to do with all of those reasons, all those marginalizing factors. So we're really taking it upon ourselves to try to make those connections. And so on our website and on our social media as well, but on our website, voxfem.org, VoxFem.org, you can browse through all the singer-songwriters, all the visual artists, all the change makers. We'll put Dr. Tamara Dickson on there as well. And every time we feature somebody, we make a page for them. So you can really go through this whole group. You can listen to the music, you can see the artwork, you can find out where to get their work, to contact them, or to support the work, or get some support for yourself for free. And so there's a lot of things to read and see and listen to, and it's all really magical, really molecule rearranging and healing. So you're a part of that. I want to thank you so much for being here today.
Thank you for having me. This has been really fun and cool.
On VoxFem,
the hard work that you do with VoxFem as well. Just amplifying those voices. I've always loved the project since it was a baby idea, and I've loved seeing how it's grown, and all of the interviews that you've done and the artists that you've been able to feature. It's awesome work.
Thank you. And since it was a baby film.
Yeah.
Yeah. Yes. So thank you so much for being on VoxFem Global Health Minute. We got you for a minute and we kept you for over an hour. Thank you for watching, and for this will be up. So anyone that you feel like should see this, it's going to be here. You know, tell people, share the link, subscribe, follow, and you'll get notifications when we come on. So with that, I hate to let you go, but we'll have you back. I know you've got some other things going on, and when that happens, we'll have you back on to talk about it.
Thank you. That'd be really cool.
Thank you, Dr. Dickson. Bye, everybody. Be well.